Sudden cardiac arrest can occur at any time with little to no warning. When every second counts, knowing how to respond immediately can make the difference between life and death. And it was those few precious seconds that saved the life of 65-year-old Judy Schlegel on the morning of Good Friday, 2016.
Well, my typical day is getting up, having my coffee, and I had planned to go grocery shopping for Easter dinner. I was meeting my cousins for breakfast and didn't have any symptoms, didn't know what the day was going to bring for me, and that's what I remember.
When I was at work and I received a phone call from my cousin, which wasn't normal for her to call me during that hour, so I answered the phone, and she said, "Jody, this is your cousin Laura, and we're at Perkins with your mom." And I was about to tell her, "I'm sorry, I can't come to breakfast, I'm working." And she said, "We think your mom has had a heart attack, and someone has called 911 and they're getting ready to work on her." My cousin said that they were doing CPR on her, and at the time I just assumed that it was the medics. I didn't realize that Shikako Jarasmic, who was a nursing instructor and a nurse at Sharon Regional, and her aunt Marge Motes, who had been a CPR instructor with us also, I didn't realize that they were at the restaurant, and when they saw that Mom had gone unconscious, Shikako immediately was thinking, was it a stroke? Was she choking? What was going on? And she realized that there was something heart related. And our family said that the two of them came over immediately and they began to do CPR on her. And then as I stayed on the phone with my cousin, that's when she started to say, the medics are here now and they're getting ready to shock her. That's the point where I realized that this wasn't just a normal heart attack, it wasn't a blockage, but that there obviously was, that her heart had either stopped or that it was beating so erratically that we were going to have to get her help right away.
When you hear somebody screaming and screaming for help in a restaurant, you assume somebody might be choking. So I looked over to her table and she was just sitting there with her eyes closed, not responding to her family member. So I knew there was something else was wrong. She wasn't choking. Then I knew I had to just go and see what's going on, and I knew something was wrong with her heart. So I had to administer CPR.
My cousin stayed on the phone with me through the whole thing, and she was recounting the events as they were occurring, and the medics were asking what hospital should we take her to. And immediately I responded Sharon Regional, and I didn't choose Sharon because I'm an employee there. I didn't choose it because it was convenient. I would have gotten my car and we would have been going to Cleveland, we would have gone to Pittsburgh, anywhere that I thought was the best care for her. But because I know what we do there, it was easy for me to make the decision to say I want her brought here.
Because of the advance notification from EMS, a code was called prior to Judy's arrival. EMS had stabilized her, and the ER staff was ready and waiting. The cardiology team was also assembling and met Judy in the ER minutes after her arrival.
She was very fortunate that she had experienced people there that knew how to do CPR. The EMS staff did an excellent job. They shocked her, they gave her medication to help stabilize her heart. We did take her to the cath lab and open an artery. The main thing with her was that her pump and chamber was weak, so she required that device called a defibrillator. So she did eventually get that placed, and that should help prevent any further episodes, because if she has a dangerous rhythm in the future, the defibrillator will shock her heart back in a normal rhythm and save her life.
Was able to go the back door down to the ED, and when I went down, I saw one of our nurses pulling off the EKG, so they already had some of the information on what was going on. And I turned the corner to the room where we typically treat our STEMI patients, and Dr. Ryan and I believe Dr. Horvath were already assembled there. They were ready and they were waiting for her. And you know, I turned into daughter at that point, and I was going to be no help to anybody, and they smartly sequestered me away into the private waiting room, and I prayed and I let them do what they do best. Mom's story is certainly one of perfect timing. If she had been alone, if she hadn't gotten immediate care, we know that she wouldn't have been able to survive this event.
During a heart attack, minutes matter. Knowing the signs and symptoms and knowing how to respond immediately dramatically increases the chance of survival.
Here at Sharon Regional, we're dedicated to preventing and treating heart disease. Over the past year, we've worked on our outreach efforts to teach patients the signs and symptoms of a heart attack, but also what to do if a patient goes into sudden cardiac arrest. We know that about 50% of cardiac arrests occur outside of the hospital setting, so bystanders and families knowing what to do in that emergency and starting CPR can save thousands of lives.
The care that Mom received before she made it to the hospital certainly saved her life, but the interventions that were made during her hospital stay, the follow-up cardiac rehab, has made all the difference in the quality of her life.
This past July, I had a cardiology appointment with Dr. Mignella, and he was just so thrilled with my numbers. The ejection fraction was up, my heart size was down, and he was just so thrilled that I am feeling so well and I'm doing so well.
Because of the quick intervention and the comprehensive care she received at Sharon Regional, Judy is able to spend time with her family, doing the things she enjoys.
I love baking and watching my grandchildren enjoy the cookies and the cakes that I make, and they're always so great to say, "It's so good, Grandma," and the family gets together, and I really love that.
As an accredited chest pain center, Sharon Regional adheres to the highest standards in the country for heart attack care by demonstrating expertise in numerous areas, including integrating the emergency department with the local emergency medical system, and for assessing, diagnosing, and treating patients quickly. This signifies a new level of heart care for the community.
These are the reasons why I trust my family's care to Sharon Regional.